Sponsored by the James Madison Council.
Hello, this is David Rubenstein. I'm going to be in conversation today with Lawrence Wright about his new book, The Plague Year, America in the Time of COVID. Lawrence Wright is a Pulitzer Prize winner, a distinguished journalist and author, and we're very pleased to have him here today. Welcome, Lawrence.
Thank you, David. It's great to be with you.
So what prompted you to write a book about COVID, particularly because things are changing so much? So when you're doing the research, are you not worried that by the time the book comes out, it might be dated?
Yeah, I had that concern, but my editor at the New Yorker, David Remnick, called me in June of 2020 and asked me to write this, what he called big dumb story about what this disease has done to us. And I thought about how there's not a single part of our society that hasn't been touched by COVID. And, I thought about, finances, travel, work, everything that you can imagine, our home life, our family life, everything has been touched by COVID. And so I felt compelled to try to grab as much as I could and try to understand it while it was happening.
Okay, so when you're writing a book about COVID during COVID, do you have to do it virtually?
Yeah, that's true. I mean, I love interviewing people. I get a lot of pleasure out of meeting my sources and getting to understand where they're coming from. But this was not possible this time. And of course, it was in some respects more efficient. And I wrote the book in record time because in part, I had nothing else to do. So there were advantages, I suppose.
Well, I should tell you, I spend a lot of time, like other people probably watching now, on dealing with COVID. I watched every show. I did interviews myself, and I learned a lot from your book. So you really did a great job of doing research because there are a lot of things in there I did not know. And some of them I'd like to ask you about now.
Sure.
So first, in your view, did the virus come from a wet market, from a virology lab, or we still really don't know?
Well, David, the honest answer is there's no proof for either theory. There's the precedent of SARS, which it came from bats. It passed through probably an intermediate animal, maybe a civet cat in one of the wet markets in Guangdong. And it looked for a long time like that was where SARS-2, the COVID-19 virus, came from. But it hasn't been found in bats. It hasn't been found in an intermediate animal. And so until we find such a thing, it's a good theory. But now, on the other hand, could it have come from the lab? Well, the answer is yes, it could have. Diseases escape from labs far more frequently than people would like to think. I mean, we've had diseases escape from the Center for Disease Control. Fort Detrick, smallpox escaped from labs in the UK on 3 different occasions, killing nearly 100 people. SARS-1 escaped from labs in China on at least 4 occasions. So yes, that happens. And it's Chinese behavior that makes it seem more plausible.
Let's suppose wherever it came from, had the Chinese given the genetic code of the virus to, let's say, Americans sooner, would it have made a difference in the death toll in the United States or in producing the vaccine?
Yes, it could have, certainly. I mean, the Chinese knew, in late December that they were dealing with a novel virus and it was very dangerous. They downplayed it. Right after New Year's, the director of Chinese CDC told the American director of CDC, Robert Redfield, that the disease was not humanly transmissible, even though it was then transmitting from patients to doctors in the hospital. And had the Chinese been willing to send the genetic code to American researchers, they could have gotten started on it earlier. We didn't get it until the 20th of January. There's 3 weeks had passed. They could have been very valuable. And not just the genetic code, to this day, I don't think that the Chinese have given a sample of the virus to any other country, certainly not to the United States. And a sample of the virus was needed in order to create the test. And so we had to wait until the first case turned up in Washington State in mid-January to be able to begin the manufacture of the tests from the Center for Disease Control.
So to date, more than 650,000 Americans and 4 million people around the world have died from COVID. Had something been done differently, could COVID have been less harsh in terms of its treatment of people in this country? In other words, what could we have done in this country that would have made it possible to have fewer people die?
David, every country was bound to be affected by this, but and the United States was certainly going to lose tens of thousands of people, but maybe not hundreds of thousands. If you look at the difference between, oh, let's say South Korea, and which is 25, 26 million people, has fewer deaths than South Dakota. And for that matter, South Dakota has about 900,000 people in it, and so does Vermont. But Vermont, the South Dakota death toll is 12 times higher than that of Vermont. So leadership makes a big difference. And you can go through these rankings. I mean, there was a global pandemic report, a global preparedness for a pandemic report that came out in October of 2019, just before the disease began to circulate in Wuhan. And it ranked the countries of the world in terms of their readiness to handle a global pandemic. And number one, in terms of being the best prepared nation in the world, was the United States. Number two was the United Kingdom. And if you had turned those rankings upside down, it might have been a truer representation of what was about to happen.
Well, two things we were not prepared for, it seems, in hindsight. I'd like your views on it. One, we didn't have enough equipment. We didn't have enough masks and other kinds of things that might have been helpful early on. And secondly, we didn't know how to treat people who went into hospitals very well. And as a result, many people went on ventilators, did not get off ventilators. So what have we learned about how to treat people? And what have we learned about how to get better PPE, as they call it?
Well, the national storehouse was severely depleted, in part because of the H1N1 flu epidemic that took place pandemic that took place during the Obama administration. And then when the Trump administration came in, they found that out and did nothing about it. So we were already short of supplies. As far as therapeutics, there was a mistaken assumption on the part of public health officials that this was going to be like the flu. And so a lot of the preparation, the warnings, if you remember the word fomites, the idea that this was going to be germs on surfaces, that it would spread through sneezing like the flu. It really was far more dangerous and tricky. But the big problem was we didn't know, and the Chinese didn't tell us for quite a while, that it spread through asymptomatic transmission. And so we weren't prepared. We didn't know what we were dealing with. And then when we got people who were sick and in the hospital, getting them on ventilators was practically the only treatment for serious cases. And the problem with that is when people get on ventilators, they very often don't get off of them. So we relied way too much on that. We had hope that antibody transfusions from people who had recovered from COVID might help. And it turned out that that wasn't a very effective means of treatment. It wasn't really until we had the Regeneron monoclonal antibodies that we had something that really made a startling difference in the outcomes of serious disease.
Well, early on, President Trump talked to Bob Woodward in a private conversation. He said, this is a very, very serious problem, and COVID is very serious. But in his public remarks, President Trump kind of said it was not that significant. It was like it would magically disappear. What do you think President Trump believed? And do you think President Trump should have been more alarmist in terms of telling people how serious it was in the beginning?
Well, I've studied the leadership of a lot of different political figures around the world, and he didn't need to be alarmist, but he did need to be candid and compassionate, and he wasn't either. This was a disease that was very challenging. Uh, we needed trust. If you look at the countries that did well around the world in terms of handling COVID, the main factor that you see is there's a high level of trust in the government. And countries that have a fractured level of trust like ours really did very poorly. And it was the president undermined that trust severely by sabotaging oftentimes his own administration's plans about mask wearing, for instance. That was, had people had trust in the government, had the leader of our country said, these masks will save your lives and I'm going to wear one, then it might have been quite a different outcome. Instead, he went to a mask making factory without a mask. I think he demonstrated very clearly what he thought of that.
Were you surprised that the 1980 and 1918 Spanish flu, so-called, which really wasn't Spanish, the three main things that were recommended then was wash your hands, wear a mask, and socially distance. And that was what we were told 100 years later. Were you surprised during your research that basically, absent vaccines, we really hadn't made any progress in dealing with these kind of things?
No, David, before I wrote this book, I had written a novel about a pandemic called The End of October, and it came out in the middle of this pandemic in April of 2020. But while I was researching that book, I would talk to people in public health. And I asked them if a pandemic like 1918 came back in our current day, would we be any better prepared than our ancestors were a century ago? And the answer was, absent a vaccine or an effective therapeutic, no, we'd be worse off because of modern transportation. We would have a pandemic, a global pandemic almost instantly. And that's exactly what happened.
So one of the amazing things through this pandemic has been the vaccine. A normal vaccine takes 4 to 7 years to develop. I think the polio vaccine took 7 years. Maybe Ebola took 4 years. Measles maybe 4 years. But this was in less than a year. So how did that happen? How did the Trump administration manage to pull that off? And who deserves the most credit for getting the vaccine developed?
Well, when we talk about the vaccine, first of all, this is a triumph of medical science. It's hard to even think back about when you reference those other vaccines. They were record-breaking in their day. But when this pandemic hit, the earliest expectation that we would have an effective vaccine in the arms of Americans was a year and a half. In other words, in about a month from now, we would not have any vaccines until then. And but at the National Institute of Allergies and Infectious Diseases, which is Dr. Fauci's shop, Barney Graham and Jason McClellan, they got this genetic sequence of the virus on January 20th, and they had the vaccine 2 days later. 6 weeks later, Moderna was injecting volunteers in their first trial. That nothing in immunology history compares with that. And it only happened because Barney and Jason had been working on pure science of coronavirus vaccines for the SARS virus and for MERS, another coronavirus. So they already had a template to deal with a coronavirus. And, it was pure science that got us to where we are now.
Now, there was a White House coronavirus task force initially headed, I think always headed by Vice President Pence, or actually initially it was headed by the head of the Secretary of HHS, but then Vice President Pence. How did that task force actually work? It seems as if it was maybe a little dysfunctional at times. People were arguing with each other. Deborah Birx and against the Stanford radiologist, and some other people were involved who didn't have a lot of healthcare background. What was your assessment of whether that task force helped or didn't help?
Well, David, actually, the task force was created by Matthew Pottinger. who was a deputy national security advisor. And um, we were really lucky that he was in government at the time. He had been a reporter for the Wall Street Journal in China during the first SARS outbreak in 2002 and 3. And he spoke fluent Mandarin. And so when this, and having been there, he realized what the Chinese did during that outbreak when World Health Authorities went to China to try to find out what was going on with this new virus. The Chinese hid patients in ambulances and taxis until they left town. So the whole international health regulations were changed to deal with the lack of transparency on the part of the Chinese. So when Pottinger started hearing about what was going on in China, his reportorial instincts were awakened, and he began making calls to sources in China. And it was he who first found out, for instance, that masks would be effective. That's and he found out that it was transmissible among humans. And he began to assemble public health authorities like Dr. Fauci and Redfield, and also Chief of Staff in the administration, Mick Mulvaney, and the Treasury Secretary and other players inside the White House to talk about this foreboding disease that was on the horizon. And that's where the coronavirus task force came from.
But it seemed as if it was politicized a bit. People were trying to make certain arguments that might be politically appealing, or is that wrong?
You know, I guess I would say that the members of this task force were playing to their interests. The public health people, for instance, had an axiom that travel bans don't work because by the time you enforce one, the virus has already jumped over the fence, and all it does is obstruct trade and block the passage of medical supplies and so on. But we had thousands and thousands of people coming from China every single day at a time when internal transportation in China had been shut down. So the health authorities were opposed to it. The public health, the Treasury people were very opposed to it. So it took a creative thinker like Pottinger to realize, whatever you think about the past, right now we're dealing with an influx of infected people who are spreading all over America, and we need to put a stop to it. It was all through the coronavirus task force, there were fierce arguments about the utility of masks, about the questionable, the question of halting flights also from Europe, which did happen. And, you know, these were really hard fought battles, very personal at times.
So one of the amazing things was the development of a vaccine so quickly, but it seems as if the process of getting the vaccine disseminated and distributed to people wasn't as efficient. Was that something you focused on, and why do you think it didn't work that as well as people had wanted it to work?
Well, David, it was a matter of governing. You know, you had to have a government that was going to, you know, take control of, for instance, the PPE and so on, the kinds of distribution that was left to the states to fight among themselves to try to get the masks and so on from China. Same thing with the vaccines. The Trump administration expected to have 40 million people inoculated by the end of 2020. And in effect, they actually had 2 million. So judged by their own metrics, it was a colossal failure.
And today, the Biden administration is responsible for what's going on in terms of getting the things distributed and so forth. Do you think the Biden administration has done a better job, worse job, or about the same as the Trump administration in handling this whole crisis?
This has been a really difficult period with this new variant. You know, it's 6 to 10 times more contagious than the original COVID-19 virus. So it poses a terrific challenge, but basically everyone who is not inoculated is going to get it. And some people who have been inoculated are going to get it probably less severely, but it is a real challenge. And so the stakes have been raised extremely high. Unless we have herd immunity, which we're short of, but we could achieve it, perhaps with a mask mandate. Um, I don't think that we're going to be able to block the proliferation of this particular disease. And of course, I worry that it will mutate and create a new variant that might be as contagious and maybe more deadly.
So we have some questions that have been sent in, and I'm going to read them to you. Before I do so, I just one final question. What was the biggest surprise and the biggest disappointment through this whole research effort? The big thing that most surprised you and the thing that most disappointed you in terms of what you learned?
Well, the surprise, I think, was that the vaccine was made so quickly, and oh, what a blessing it was. You know, the disappointment, David, as a young reporter, I wrote several stories that took me to the Center for Disease Control, and I was dazzled. And the people that I met there, they were so intelligent, they were courageous, they would go off to hot zones that I wouldn't want to get close to. They looked at the CDC as a kind of holy place. You know, I mean, they felt they were on a mission. To see that superb institution so humbled by and see it fail America as it did in its catastrophic test efforts, which delayed our understanding of the progress of this disease for week after week after week. That has just been heartbreaking.
So let's go to questions that have been sent in. One from Elizabeth. When do you think the pandemic will be over for good?
Well, it's likely that the pandemic will die down and it will subside into something called an endemic disease like flu. It's shown it has the capacity to mutate. We'll probably have a coronavirus in our lives for a considerable amount of time. We may be looking at new flu shots come every year. We may have new coronavirus shots every year. So maybe we will be able to keep it at bay. I wouldn't put it past the geniuses that invented the coronavirus vaccine to come up with a coronavirus vaccine that would take care of all of them, just as they hope one day soon to have an influenza vaccine that will put that to rest.
From Carolyn, we have this question. Any evidence that this virus can be eradicated like smallpox, or because of mutations in the global scale, is that too difficult? Will we always be dealing with this virus?
Well, it could be possible to eradicate it, I think, if we had universal vaccines, but I think we're a long way from achieving that.
Okay. Now, a question has come in about a previous book that you've written, which won the Pulitzer Prize, The Looming Tower. The question is from Spencer. The Looming Tower was the most cogent description of the decades leading up to 9/11. What are your thoughts about the Afghanistan withdrawal and its future?
Well, you know, it's a difficult problem. We spent 20 years in Afghanistan, and now it seems like we've circled back to the beginning, but Afghan people themselves have changed. They've had 20 years of progress that have now threatened to be totally destroyed. As a person who spent a lot of time studying terrorism, the thing that I worry about the most is that Al-Qaeda will be able to reopen its sanctuaries and training grounds and reconstitute itself. There were only 300 or 400 guys in Al-Qaeda on 9/11, and now it has affiliates from Morocco all the way to Bangladesh. And there are as many as 40,000 members in various Al-Qaeda chapters. So it's a very dangerous situation. And I think that we should be on guard for the outbreak of terror in the future.
Where were you on 9/11?
In Austin, on Tuesdays, I used to have a Spanish-speaking breakfast. And so after breakfast, I got in the car and NPR was on and the first plane had hit, and I knew that my life was going to change instantly.
So this is a question from, question from Robert. Writing about Al-Qaeda, 9/11, and now the pandemic, what ongoing and immediate threats do you see as causing further major disruption to America in months ahead? That's a tough one.
Yeah, thank you. I'll leave the economic answer to you, but I I am worried about terrorism. I think we've underplayed the danger that we're facing because, with so many more in the world who are affiliated with not just Al Qaeda, but even white supremacist groups, which like there's one calls itself the Base, which is what Al Qaeda means. They actually, this is a white supremacist group that reads Al Qaeda training manuals. Uh, they there are white supremacists that are trained as mercenaries in Ukraine on both sides just to get the experience. During the insurrection in January 6th, Senator Patty Murray said that there were people roaming down the halls. Her husband was sitting on the floor with his feet against the door, but they were crying, Allahu Akbar. So, this penetration of the terror model into domestic life in America is very, very dangerous and discouraging.
Suppose we had not had a vaccine, or we don't have a vaccine. What would happen now? Suppose the vaccine had not been developed. It took 4 or 5 years to develop it. How serious would the problem now be?
Well, you could look at Brazil and India to see what it's like when you have countries that are dealing with an incredibly contagious variant. And they, in both cases, had an inadequate supply of vaccine. It just raged through the whole population. We don't have any idea how many people have actually perished in either of those countries.
So as the result of your research, who did you come away with most admiring? Who did you write about in this book? You wrote about a lot of very impressive people, some less impressive. Was there somebody that you came away with really most admiring?
David, that's a hard question. I mentioned Barney Graham and Jason McClellan. I think they deserve the Nobel Prize. But there were frontline people I talked to, doctors at Bellevue. There's a doctor named Ebony Hilton in Virginia who, very movingly talks about the toll, the disparate toll that is taken on minority communities. And there's, one of the things I learned in this is there's this huge body of grief that just hadn't been expressed, especially under the Trump administration. And I ran into so many people whose lives had been totally torn apart. And I don't think that I appreciated the depth of the wound that this disease has caused America. And I think that's probably not unique to me. But right now, as we talk, 1 out of 500 Americans is dead of COVID. We may reach 1 million dead. We're already right about the same number that died of the 1918 flu, about the same number of Americans who died in the Civil War, the bloodiest conflict in American history. So the scale of this disaster is something that I still think is not appreciated.
Did you worry about getting COVID yourself?
Oh, of course. And I had a hard time getting an appointment to get my shot. And then we were overrun in Austin. It was my second was delayed. But when I got my first shot, you're supposed to wait for 15 minutes to see if you collapse or something. And I used that time to write a thank you note to Jason and to Barney. And
did you ever worry about the fact that you might not get the vaccine, it might not be available to you, or did you say to people, I'm writing a book about this, I should get in the head of the line or something like that?
I'm not saying I'm not capable of doing such a thing, David, but I fortunately was spared that. But it was very hard to get. Actually, my piano teacher got me my first appointment. He was one of those people that constantly refreshed his screen and was able to find a way. He got more than 100 people to get their vaccine appointment and ferried many of them to the site where they got the shot.
Final question. What is the main message you want to convey to a reader of this book in about 20 seconds?
Well, the book is about America in crisis, and we didn't do a very good job. I think of the coronavirus being like an X-ray, and you can see into your society and all the broken places. And so we know now really what kind of country we are, and we see how shattered we've been by this. But we have the opportunity to repair ourselves because we now know what needs to be done. And I was talking to an Italian scholar named Gianna Pomata who lives in Bologna, and I asked her. She's a history. Her disease. Excuse me. Her specialty is disease history, and she compared it to the bubonic plague in the 14th century of Italy. Not in terms of its scale. I mean, it killed a third of Europe, but in terms of opening up people's minds, fresh thinking is what happened after the plague. People realized that what they were doing in the past didn't work, and that fresh thinking is what eventually led to the Renaissance. So we have the opportunity to judge how do we govern ourselves, how do we treat each other, how can we regain our trust in our government and our communities and in each other. If we turn to that, then this tragedy will have a good ending. But if we fail to heed the lessons of this, another coronavirus or influenza or some other terrible disease is standing on the corner waiting to greet us.
I want to thank you, Lawrence Wright, for discussing your new book, The Plague Year: America in the Time of COVID. I really enjoyed our conversation. I enjoyed reading the book. Thank you for giving us your time.
It's been great talking to you, David. Thanks for taking the time.
Okay.